Hello, sir. My name is Noe, and today I will be assessing your lower leg and ankle. Hello, sir. Today I will be assessing ankle inversion, active range of motion. And I would like for you to please lie down prone, which means lying on your stomach. So the first thing to find ankle inversion is to find the axis, which is just the insertion point of the Achilles tendon. The stationary arm is in line with the midline of your calf or the lower leg of the tibia and fibula. And the moving arm is the midline of the calcaneus. My axis. And then I would ask the patient to invert or, there we go. Measure that. You can go ahead and go back. Now I would measure this bilaterally. Find my axis, the Achilles tendon, in line with the midline of your calf, and then the movement arm, the in line with the calcaneus. And would you please invert your foot for me? Thank you. And the normal range of motion would be 0 to 10 degrees. And this is a normal range of motion. Thank you. Yes, sir. The next test today is the test of distal tibiofibular joint posterior glide, passive range of motion. From lying prone, which means laying on your stomach, would you please switch over to supine, which means lying on your back? Okay. So the first thing I will do is test his right leg. I will use my right hand to stabilize his tibia. And stabilizing means just so that it doesn't move backwards and forwards and side to side. The next thing I will do is use my left hand with the thenar eminence, find his fibula, and since it's a posterior glide, I'm going to push it downwards towards the ground, towards the floor. And what I'm finding or looking for is laxity or pain signified by the patient. And I'm going to perform this bilaterally. Same thing. Now with my left hand, my right hand, thenar eminence, and push down. Looking for pain and laxity. And this test is to test the tibiofibular joint in here from with the tibiofibular joint and its ligaments. It's supposed to have a joint end feel. Thank you. Yes, sir. Now for this next test, it's a grade 3 manual muscle test for ankle plantar flexion. So what I would like for you to do first is from being lying supine, would you please stand up for me? Okay, thank you. Now I would like for you to stabilize yourself on the nearest object. Now I would like for you to plantar flex, which means to stand up on your tiptoes on your right foot or your right leg, please. Okay, thank you. And now on your left leg. Okay, thank you. Now since this is a grade 3 manual muscle test, it only asks for full range of motion, one rep. And this test is to assess the gastrocnemius muscles that attaches with the Achilles tendon on the calcaneus, and the soleus muscle which lies underneath. Thank you. Yes, sir. Now for this next test, it's a Thompson test, which is for Achilles tendon rupture. Now from being standing up, can you please lay prone, which means on your belly? Okay. So for the Thompson test, the first thing I will be doing is to squeeze your calf area, or your calf, your gastroc, and your soleus. And I will be looking for plantar flexion, which means kind of pushing on the gas pedal or standing on your tiptoes. So as we see here, we do have some plantar flexion, which means that it is a negative test, which means that there's no Achilles tendon rupture. And for a positive test, it would be where there would be pain for the patient, and as well as there would be little to no plantar flexion movement. Now, since I did it on his left side, I will be performing it bilaterally on his right side now. As we can see, we do have some movement. And now the Thompson test has a sensitivity of 93 to 99%, which means that it's very effective at ruling in Achilles tendon rupture. As for specificity, it has a 75 to 99%, which means that it's also very good at ruling out Achilles tendon rupture. Thank you. Yes, sir. Now for this next test, it's called the Taylor tilt test. Now, would you please, from lying prone, which means on your belly, can you please flip over and so you can lay on your back? Thank you. The Taylor tilt test, I will be first assessing his ATF on the lateral side, but as you can see, so don't worry about it. I'm going to say all of the structures around it, but I will focus with the medial side, and then on the other leg, we'll focus on the lateral side. The first thing I'm going to do to test his anterior talofibular ligament, I'm going to maximally plantar flex his foot and invert it. Now the next thing I'm going to do is have his ankle in a neutral position. Neutral position. Now, once it's in a neutral position, I'm going to invert it for his CF, which is it's on the lateral side, as you can't see, but that's perfectly fine. I'm going to test his CF, his crural fibular ligament. And now I'm going to, for this next part of the test, I'm going to dorsiflex it. Dorsiflex his ankle as much as I can. And then I'm going to immediately, once it's dorsiflexed, I'm going to immediately tilt it or evert his foot for the deltoid complex here. And I'm going to invert his foot for the posterior, or the PTF, the posterior talofibular ligament. Now I will do this bilaterally, and you'll be able to see the lateral side much better. So for the ATF, plantar flex and invert the anterior talofibular ligament. For the CF, which is the crural fibular ligament, I'm going to place it in a neutral position. I will place his ankle in a neutral position and invert, which would test his medial ligament here. Now the sensitivity for the lateral side, which is the ATF and his CF, the sensitivity is a 29 to 100%, which means that it's either really good or very bad, or it's all right. Never mind, it's pretty good at ruling in this these laxities or pain or injuries to the ATF ligament and the CF ligament, and it also has a specificity of 47 to 99%, which means that it's also pretty good at ruling it out. Now, on acute injuries, it does have a sensitivity of 100%, which means that it's very effective at also ruling in ATF or CF injuries. And this test was a negative test since there was no pain or increased laxity. Now for the medial aspect, which is the deltoid complex, and the PTF, which is over here on the lateral side, it does have a sensitivity and specificity of unknown amounts. Thank you. Yes, sir. Now for this next test, it's the palpitation of the fibularis longus tendon. So once you were lying supine on your back, now can you please lie up on your side, on your right side? Thank you. Now for the fibularis tendon, I'm going to find his fibula, the lateral malleolus, and as you can see, right here. Let's see, right here. Now I'm going to perform this bilaterally. Can you please flip over for me? As the same, the fibula, lateral malleolus. Thank you. Yes, sir. Now for this next one, it's a palpitation of the navicular tuberosity. I had you lying on your right side. Now can you please lay supine on your back? Now for the navicular tuberosity, first I'm going to find his medial malleolus, the inside. Medial malleolus. Now I'm going to move my fingers in a anterior and inferior manner until I find a elevated ridge. It's quite noticeable, and it's the navicular tuberosity. Feels like a small mountain, little ridge. Now I'm going to perform this bilaterally. Now the same thing. Find his his medial malleolus, and descend in a anterior and inferior manner till I find a small ridge, his navicular tuberosity. Thank you.